Bihar is the third most populous state in India. Despite improvements in health indicators over time and a decade since the launch of the National Health Mission, the state still had a neonatal mortality of 28 and an infant mortality of 42 per 1,000 live births in 2014, one amongst the highest in the country. This prompted the need to replan life-saving interventions at scale across the state by the government of Bihar and its technical partners. Several studies found that a common determinant of neonatal mortality was very low birth weight, the mortality among these babies being 22% and morbidity 56% in 2015 in Bihar. Field trials done by Search at Gadchiroli, Maharashtra, had previously demonstrated that around 2/3 of the deaths among preterm newborns could be prevented using simple, supportive care like extra breastfeeding, providing extra warmth, and extra cleanliness. As a potential solution, Care India designed an intervention and implemented it across all districts and block-level public health facilities of Bihar in June 2015. In May 2016, the government of Bihar issued a guideline based on CARE's pilot to include similar efforts for deliveries in all public and private hospitals, as well as for deliveries done at home. The objectives of the intervention were to improve the identification and recording of weak newborns in public hospitals, provide extra care and counseling at public health facilities, and ensure counseling of families at their doorstep, which includes home visits by frontline workers and telephonic tracking by block-level health managers on extra care and danger signs. To support these objectives, the ongoing Amanat nurse mentoring teams from CARE conducted bedside mentoring, where government nurses were trained on identification and immediate care of weak newborns, active management of third stage of labor, and asphyxia management. Since manual recording and the corrective course of action demanded more time than available, a digital real-time analysis and feedback tool was subsequently developed by CARE and is being used by its staff since November 2018. RAFT was a mobile-based intervention to facilitate day-to-day activities at the block level and flag alerts for upcoming and due activities for weak newborns, making the system smoother and more efficient at each level. When the COVID-19 pandemic hit in March 2020 and the government of Bihar had to rightly divert its resources to manage the pandemic, Care India stepped up and deployed additional dedicated staff to support the frontline workers in increasing the number of home visits and improving the quality of doorstep counseling to ensure the weak newborn intervention continues to sustain momentum. Subsequently, a 24/7 weak and sick newborn call center was set up in December 2020. With the help of frontline health workers, this call center gives additional emphasis to tracking weak and sick newborns, ensures regular home-based care, and supports in reaching health facilities. This call center engages in two types of calls: inbound calls, which are open 24/7, and outbound calls, which are made during office hours. Prompt counseling and emergency support comprises immediate referral to an appropriate facility, provision of an ambulance for referral, and extra counseling by a specialist medical officer. The success of this intervention can be substantiated by the findings of the annual rounds of the independent study done by Care India's Concurrent Measurement and Learning Cell. The proportion of families that have been informed that their baby is weak after reaching home has increased from 43% in the year 2019 to 60% in the year 2021. And the proportion of mothers of newborns counseled on extra care after reaching home has increased from 40% in the year 2019 to 58% in the year 2021. With persistent efforts of all partners in this intervention, neonatal morbidity has reduced from 56% in the year 2015 to 35% in the year 2021. And neonatal mortality has reduced from 22% in the year 2015 to 16% in the year 2021 among very low birth weight babies. These results have contributed to reducing Bihar's overall neonatal mortality rate to 25 and infant mortality to 29 per 1,000 live births.